Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae. It's the most wonderful time of the year, Dr.
You could
Shives.
almost consig that, couldn't you?
We're not going to do
never
that.
mind.
That was last year. We learned from our mistake. The holidays mean family and friends, decorations, lights, candles. Some of us even bring a real tree into our home.
Well, with all these trappings at the holidays, they're all intended to bring joy. They can, unfortunately, present some hazards as well.
I can see it. Adults on ladders, children with access to cords and candles. Pretty much anything can become hazardous.
Well, here with tips for staying safe this holiday season is emergency medicine physician Dr. Luke Wood. Welcome back to the program, Dr. Wood. Nice to see you. Happy holidays.
Thank you. It's good to be here again.
I know you don't like talking about all the things that can go wrong when everybody gets together, but that is what happens when you go into the emergency department.
Unfortunately, that's the case, yeah. Usually when you're seeing me, it's not necessarily a good thing.
What's the number one thing that at this time of year people show up in the emergency department?
You know, I don't know if there's any number one thing. There's certainly things during the winter that we see a lot more of in the emergency department than other times of the year. One thing that we'll see a little bit more of during the typical holiday season is we see a little bit more chest pain. And there's probably a variety of reasons for that. One, people aren't necessarily watching what they're eating necessarily as much. And people are also sometimes exerting themselves a little bit more, especially if we get a nice little snowstorm and they got to clear out the driveway.
Are you listening, Florida? It can happen.
Yeah. Consider yourself lucky.
So, yeah, there is such a thing as some people have called it the holiday heart syndrome. So tell us, you get chest pain, whether you're shoveling snow or whatever, you overindulge, maybe you had a little bit too much alcohol, but you get this chest pain. What should you do? Tell us the steps.
Well, you know, I think the one thing, if I can convey one piece of information for listeners, is that any type of exertional chest pain really kind of concerns us. So if people are used to walking, say, 2 miles a morning or something along those lines, and they start to notice that they're either developing some chest tightness while they're exerting themselves, or they're feeling more short of breath than they typically would be, those are all reasons to come into the emergency department and be evaluated. Of course, during the winter, shoveling is a pretty exertional exercise. And so it's not at all uncommon that we see people who develop this chest tightness, maybe with some radiation into the shoulders or down the arms, that brings them into the emergency department while they're shoveling. And that certainly catches my attention as an emergency physician. And so, really most types of chest pain, but especially any type of chest pain with exertion, really warrants an emergency evaluation. And then, oftentimes what we'll ask about is associated symptoms. So if people are also feeling, nauseated or sweating with this, that's really indicative that this could be some type of cardiac process, and they gotta get into the emergency department sooner rather than later to be evaluated.
Usually best to call 911. And is the advice still to chew some aspirin? It
is, yeah. Despite all of our advances in medicine up to the year 2017, aspirin is still a great medication for acute coronary syndrome.
I was going to guess that carbon monoxide poisoning might be one of the things that you see most often this time of year.
So we certainly see a lot more carbon monoxide poisoning this time of year. Certainly the listeners in Florida and Arizona probably aren't as affected by this.
Well, but you know what? They, during hurricane season, when they have to use generators, that's when you hear them, unfortunately, having problems with it.
Absolutely, yeah. And here in Minnesota, we see a bit more carbon monoxide poisoning because, carbon monoxide poisoning comes in kind of two different forms. One is from people being exposed to carbon monoxide in the setting of a house fire or some type of combustible fire. The other type of carbon monoxide poisoning is kind of non-fire related. And so you see that with generators or if, a vehicle or some type of gas burning appliance is burning in a closed space.
Well, how does someone suspect that they might have carbon monoxide poisoning?
Good question. So, the development of a headache is usually the first symptom of carbon monoxide poisoning. And then we'll also oftentimes see this kind of in clusters where, if there's 6 people in the same home with an elevated carbon monoxide level, then they'll all come in at the same time with similar symptoms. Typically speaking, what we see first is a headache, oftentimes some nausea or confusion. When people's carbon monoxide level builds up to a critical level, they oftentimes will lose consciousness. And that's an extremely dangerous situation because then they can't, get help on their own.
As long as we're talking about poisoning, let's talk about alcohol poisoning. And I suspect you see it year-round, particularly in the summer and around the holidays. What do you do about that? Particularly, well, any person. It can happen to somebody of any age. How do you handle that problem?
Well, oftentimes it's just supportive measures, unfortunately. And when people have drank so much that they're not able to protect their airway, oftentimes we're having to intubate these people, put an endotracheal tube to do the breathing for them, and basically support them while their body metabolizes that alcohol. But it can be a really big deal.
So they're so drunk they can't breathe, and you have to put a tube down their windpipe.
They can breathe,
keep it open,
but the combination of them vomiting, which is oftentimes what we see with alcohol poisoning, that's a situation where they're at high risk for aspirating that vomit, which I'm sure is on everyone's Christmas wish list. And so oftentimes we have to intubate people to kind of support them through those rough times.
All right. Now, we hear sometimes that they pumped her stomach or they pumped his stomach. What does that mean? And do you actually do that?
I haven't really done that at all. I hear that as well, but that's really not something that we're doing routinely in the emergency department. It's oftentimes, like I said, supportive measures. And unfortunately, the body has to do most of the dirty work in the setting of a acute alcohol poisoning.
All right. Sorry, one more quick question about that. When I was a medical student, you would always hear about Epicac. And you would give somebody Epicac, I think it was by mouth, and it would make people vomit. You don't do that, no.
No, for exactly that risk of aspiration like I was talking about earlier.
Meaning when you vomit, the stuff ends up going down your windpipe and can causing inflammation, infection in the lungs.
Correct.
Okay.
What else do you want folks to know about this time of year?
Well, unfortunately, this year we see a spike in house fires, and sometimes that has to do with the Christmas tree that people have hung in their house. And so, with respect to safe use of a Christmas tree, it's good to make sure that tree is very well watered, that it's away from any heating vents, at least 3 feet or so. And then there's very common sense things. If you're putting lights on your trees, don't put on lights that have exposed wire or that are, that have obvious defective wiring to it. And so it's really important before you throw the lights on the tree to make sure that everything's intact there. And
what about for kids? What are one of the most dangerous, what happens for children at this time of year that can be dangerous?
All sorts of things. But, this time of year, we oftentimes people have a heavy Christmas tree in the corner of their living room. You don't want the little toddlers tugging on the lower branches. You want to have a really good a Christmas tree stand that is kind of appropriate for your size Christmas tree, because you can imagine if you get too small of a stand and you get a big 12-foot Christmas tree, that's an unstable situation. Also, this time of year, there's a lot of electrical wiring on the floors, and so it's good to maybe tuck that underneath rugs or make sure it's out of reach of little youngsters so they can't be dabbling with it.
All right. Well, thanks for helping us all make this a safe holiday season. Dr. Luke Wood, emergency medicine physician, Mayo Clinic. Thanks so much.
Thanks for having me. Happy holidays.